And hello again, everyone. TJ Altai 45 now. Welcome to a special edition of Health Care Unmasked presented by UTMB Health. October obviously is a breast cancer awareness month or cancer awareness month as well. And so we are excited to come on the show today because we have a special event that's happening tomorrow and an unusual guest somewhat for us in this format. And joining us to talk about this wonderful event, which is Bra Dazzle now in its 12th year, is Constable Jimmy Fullen. And Constable, thanks for coming on with us today. We appreciate you talking. You turned out to be the ramrod this year of Bra Dazzle, which would be we got a new venue now this year, a lot of surprises. One, let me just talk about, you've been involved with Bra Dazzle as kind of the, we talk about you having out with your pink overalls coming out there every year for this, but how did you get involved in kind of ramrodding and putting on this event this year?
Well, first of all, thanks for having me on your show today, TJ, and bringing awareness to this Bra Dazzle event. The reason I got involved is because Pam Swartner, who was the founder of this event, started it back 11 years ago, and she finally told us during the last event, which I believe was in 2020, she said she was going to give it up, and nobody seemed to want to kind of take the reins and move forward. So I approached Pam and said, hey, would you mind if I kind of took the chair and tried to ran with it myself? And she said, absolutely. Knowing that, I have a few little things going on here and there, so I decided to engage a couple of other people, Sheriff Trossett, Commissioner Giusti, and Lieutenant Paul Edinburgh, and asked them if they would co-chair it with me this year. And all have agreed. And so far, it's been working great.
And the men you mentioned in that too have been part of this in one way or another every single year as well. We should point out the sheriff I know is always done out. Commissioner Giusti and Paul have been out and about and always been helpful in this event. But now kind of the men are taking over the role for this, kind of a twist on things for that. And then we have a new venue this year too, huh?
Oh, absolutely. Great. We had great venue in Santa Fe at Hack Winery for all those years. But when we took the reins, we said, we'd like to make it bigger and better. So we decided to change venues and maybe move to Galveston. So we came to the San Luis Hotel. Michelle Beckwith worked with us hand in hand, helped us out. We want to make this a bigger event. We want several hundred people. Unfortunately, at Hack Winery, we're limited at the number we could bring in. With the San Luis, the numbers are unlimited. So that's why we chose to change the venue and bring in some new people that have never been involved in it before. In fact, we have, I believe, 7 corporate sponsors this year. This is their first year to join the event.
Yeah, I was just looking over it, and I'm honored, by the way. Thanks for your invite on this. I'll be the MC for the event on Thursday night as well, the San Luis Hotel. And by the way, folks, $75 for the tickets. You can show up tomorrow, pay $75, and you can come on in and enjoy yourself. Includes a dinner and some surprises. We're not going to give them away here, but there's going to be some big surprises happening out there. And all of the funds from this go to fund UTMB Health's mobile mammography unit, which is a very important part of the outreach program they have to battle breast cancer. And you're expecting a pretty big crowd here come tomorrow night, right, Jimmy?
As it stands right now, we're at about 210 people that are planning to be there tomorrow night.
Well, hopefully
Go ahead.
No, go out. I'm just going to say, hopefully we get some more out there. That's more than double what's been out there before for the events already. It's a success as far as it being in a larger venue for this.
Oh, absolutely. And that was my goal from day one, is to try to increase the size of it. That way we can bring in more revenue and be able to present a check tomorrow night for more than we've ever presented before. Our goal has been $15,000. I think we're going to exceed that, which is great for our first year chairing this event. So,
well, the doors open at 5:30. San Luis Hotel Resort, right there on the seawall in Galveston. Come on in at that time. The doors are open. The program will start a little bit later, but you have a chance to bid on some items out there. And one of the highlights of it is to see these bras that have been decorated and customized and blinged out and the like. There's some real artistry that goes into those every year, aren't there?
Oh, there truly is. And we're looking forward to seeing what people are going to be turning in tomorrow night. In the years past, we've had some bras that took up to 2 months to build and decorate. And you're going to be very surprised on how we're going to display those bras tomorrow night.
Yeah, and that's one of the surprises that we're expecting tonight. Now, one surprise we can reveal to you right now: if you attend tomorrow night, there's going to be some shirts on sale there, and you've got the hot off the presses, the shirts that will be on sale to raise money for the program. Why don't you show that to us here now, Constable? And he's got it there in his vehicle. Obviously, by the way, I should point out he's out taking care of our county at the same time that we're doing this. So you're a little off camera. You ready to show it to us here, Jimmy?
I think so. Let me flip this camera around and you'll be able to see.
All righty. There she is. So 2022 Bra Dazzle, obviously with the pink flamingo there. And that is the new shirt. You can buy those tomorrow night. It goes to help the needs of the UTMB Health and Bra Dazzle effort that's taking place Thursday night, the San Luis Hotel in Galveston. Tickets are $75 a person. Plenty of room still left, although they've already doubled the size in crowds. We're looking forward to having you out there. There'll also be items for you to bid on tomorrow night as well to get out there and take a look at everything. So make sure you get out there. Jimmy, looking forward to anything else you want to tell us about tomorrow night's event.
Man, we've got a few more tickets for sale. We actually have a few more tables to sell for corporate sponsors. If you're interested, please go to the Chamber of Commerce website for Santa Fe. Click on the link and reserve yourself a table and come on out tomorrow night and have a good time and dress in pink.
And we put the link up on our site right now for you to take a look at there for you to be able to click on. And if you want to say you got a company and you weren't aware this was going on, you can go ahead and be a part of it. You see the website there. Thanks to our friends of the Santa Fe Chamber of Commerce for hosting the website for this now. Again, 5:30 to 8:30 Thursday night, Bra Dazzle 2022. Come on out and we're in a little bit, we'll be talking with Dr. Angelica Robinson and Dr. Colleen Silva, who are our experts at UTMB Health, but they can talk about how important the mammography program is, that mobile mammography program is. Constable Fullen, thanks for coming on with us. We appreciate you, partner.
TJ, thank you. And again, I want to thank Henry Trosset, our sheriff, our county commissioner, and Lieutenant Paul Edinburgh for help co-chairing this event. And thank you again for agreeing to be our MC.
And I know, and I'm honored. I've always enjoyed this event every year myself, and going out to attending this event. So I'm glad to be a part of it. So, Constable Fullen, thanks for taking your time out. I know you've had a busy schedule. You just got back in town from being down at the border area, helping out the counties down there. So we appreciate you taking your time getting up here with us.
All right. Thank you, TJ. You have a great day.
All right. Constable Jimmy Fullen on with us there now. And now we bring in our two special guests, the real experts here on everything we'll be talking about today. They are Dr. Angelica Robinson, who is back, her return visit. We didn't scare you away from a year ago now, did we, Dr. Robinson? We're so glad to have you. And just so great to have you along here. She is a board-certified radiologist, associate professor of radiology at the University of Texas Medical Branch. She completed a surgical internship at the University of Texas Southwestern Medical Center and the University of Texas Health Science Center at San Antonio, respectively. And the list goes on and on. Recognized as a rising star in the super doctors. Is there anything you haven't done yet, Angelica?
There's a lot that I haven't done. Listen, the biggest thing that I am is a wife and mother of three. So you can imagine that's the title I'm most proud of.
Well, we're glad to have you back on the show with us here. And Dr. Colleen Silva, who is a professor in the Department of Surgery at the University of Texas Medical Branch as well, and is now the medical director of UTMB Health Breast Health. That I knew I'd get tongue-tied with this, Dr.
It's okay. It's okay.
The UTMB Health Breast Health and Imaging Center, which is an important part of this battle we're going to be talking about against breast cancer here. And Dr. Silva, thank you for coming on with us today. I should point out, Dr. Silva has got a big table. You're getting some med students to show up as well for this thing Thursday night for Bra Dazzle as well.
Yeah, so it's all our staff that work so hard for all of our breast cancer patients. I've invited all of them, and they are coming. So we're pretty excited.
Awesome.
So
it's gonna be a fun night tomorrow night, but it's for a good cause. And having both of you on, because And when you talk about mammographies, when you talk about, getting an early detection, Dr. Robinson and Dr. Silva, it is a program such as the mobile mammography unit, which has been around since 1999. It is probably pretty important for folks to understand how that outreach can save lives. And I wonder if y'all can touch on that first, just on the mobile mammography unit, of how important that is at getting out in our communities and making sure that women are being able to get their mammograms without having to worry about the hassles of going into a visit or a long drive, or even that kind of, of going into the doctor's office, which always kind of makes people nervous.
Well, I'll start with that. What I'd like to say is that often the ability to get a mammogram is tied to if you have health insurance. And often health insurance is tied to someone's employment. So as we know, during the pandemic, there were many people that lost their jobs. There were many people that transitioned to other employment as well. There's a misconception that the uninsured are often people who are not working, but there are many people who have jobs and their jobs do not offer health insurance. So often the mobile mammography unit is used as a bridge and a gap to make sure that all populations, underserved and uninsured, and those can be two separate populations, are getting the mammography care that they need. The other thing to keep in mind is that all jobs don't necessarily offer you a sick day to go in to get your mammogram. So when we are taking the mammogram to various locations, that may be where someone can maybe just go quickly on their lunch break and then go back to their employment. So we try to make it easy for patients to get in. There are many barriers, childcare, lack of insurance, not having transportation. So we're trying to take an active role in making sure that patients have the ability to get their annual screening mammogram, which should start at the age of 40 and occur every year per the American College of Radiology and the Society of Breast Imaging.
And when we talk about the importance of starting at the age of 40, why is that kind of the magical number to start with there?
So I will say there are some differing guidelines, but the American College of Radiology and Society of Breast Imaging, we have gone back and looked at studies that were done. Some were even other countries where half the country was getting screening mammograms and half the country was not. So they've been able to prove, and we've proven over the years, screening mammography does save lives. If you go younger than the age of 40, often the breast tissue is what we call dense, and that means that it's harder to see through. So we do not recommend getting a mammogram starting before the age of 40 unless patients have a significant family history of breast cancer. So 40 is the best age that we see now, given and it's a small dose of radiation that we are giving with the mammogram. So we don't want to, start at 15 years old, for example. We want to get, quote unquote, the best bang for the buck. So what is the age where we can start where we are possibly going to see a breast cancer? We know that breast cancer is more prevalent in older populations. But I was just with the residents and the medical students that we train, I was just discussing with them yesterday. People will ask me, how often do you see a breast cancer in someone who's getting their very first screening mammogram at the age of 40? And I would say it happens a few times every year, every year. There's someone, very first screening mammogram, they come in, get it, and unfortunately, we do see a cancer. And then at that point, that's where we tie in Dr. Silva. So then we work very closely together in all cases of breast cancer that are diagnosed at UTMB.
And Dr. Silva, it is one of those, it is that team handoff here that happens. And this is something we talked about a year ago that has really changed in battling breast cancer. Where it used to be is, okay, you went to your general doctor, then you went to go get your mammogram. And then from that, then maybe you're referred to someone else to then, oncology if you were to be tested or to be examined some more. And then maybe you were sent over back. But now that's all changed now. There's an actual team where it's just kind of this easy handoff. And Dr. Silva, I would think that alone has probably saved a lot of lives, just making sure it's a whole care approach versus just a one at a time type step as it was for many years.
Oh, no, absolutely. I agree. So what we don't want to happen is we don't want someone to fall through the cracks. And if you're just told you had cancer and now you don't know, what am I supposed to do? And, you're trying to figure out, well, how do I find a surgeon? How do I find a chemotherapy doctor? How do I do any of that? It's overwhelming. So we do have a whole team who helps make that transition as smooth as we possibly can. Some of those women that are coming to the event tomorrow night, those are the women who help us with that. Those are our navigators. So we make sure that from the time you get your biopsy and you get the word that this is cancer, we've already put in place that you have your appointment set up to meet with your breast surgeon and go from there. The breast surgeon does end up being oftentimes the next person you see after you get the news. And then at that point, we pull in all the other people that we might need to pull in, the plastic surgeons, the medical oncologists, the radiation oncologists. But we try to help coordinate all of those visits and make it as smooth as we possibly can.
One of the things, and we were talking about this when this came up, but I wanted to explore this more, is like Stephanie Gundrum had posted that the age used to be 30 for baseline mammograms. You were talking about that, Dr. Robinson, as her comment had come up, and why that may be different. But it doesn't mean why you may not go in for your baseline mammogram at 30 as it was before, unless you have a history in your family or you're really concerned. No one's going to turn you down if you want to have a mammogram, I should point out. But there are other things that you can be doing along the way to make sure your breast health is in shape, correct?
That is correct. So we recommend the Society of Breast Imaging, the American College of Radiology recommends that women are getting a clinical breast exam at least one time a year. So that could be from your family medicine physician, your OB-GYN, perhaps you see a nurse practitioner, but we are recommending that they're getting a clinical breast exam every year. Prior to the age of 40, as you just alluded to, if someone is having an abnormality in their breast, they should absolutely come in to see us. So that shouldn't be a barrier to them coming in to see us. We want to make sure that patients know we are here and we want to see you if something is abnormal. We know that from other studies, there are preventive things that we can be doing to prevent possibly getting breast cancer. So some of those things include limiting alcohol use, getting regular exercise, at least 30 minutes of exercise at least 3 times a week. And we know that smoking is also is associated with an increased risk of breast cancers. So there are steps that we can each be taking just to somewhat lower our risk of breast cancer. The other thing I would like to add is if patients have a significant family history of breast cancer, so that would be if you have a first-degree relative, mother, sister, or daughter who was diagnosed with breast cancer before the age of 40. At UTMB, we have a high-risk geneticist. That is someone who would evaluate your specific family history and see if, in addition to mammography, possibly other imaging would need to be done, would genetic testing need to be done, so on and so forth.
How much of a play now we see more of the genetic side of things come into play? We had a show not too long back talking about genetics coming in preventative medicine. And for both of you, how much more are we starting to see that play a role, particularly in breast cancer, but cancer battles overall?
So genetics counseling has become a huge part of the breast cancer world. And the genetics counseling guidelines continue to evolve and change, usually even as often as a couple of times a year. So it used to be, you needed to have more than 2 people in your family who've had breast cancer, and they needed to be certain ages. It's not like that anymore. Pretty much, if you get breast cancer and you're under the age of 55, or if you have a special subtype of breast cancer called triple negative and you're under the age of 70, that alone, with no one else in your family, you should be considered to be screened for genetics abnormalities. It plays a huge role. When I first started as a resident many eons ago, back then all we had there were 2 genetic tests we could do. There was called the BRCA1 and the BRCA2, and that's what everybody still is very familiar with when you talk about it. But as we've learned more about DNA We now know there's probably 10 or 12 genes that we've identified that can be, significant and increase your risk for breast cancer. And so even if you got the BRCA1 and gene testing done many years ago, now that these other 10 or 12 genes exist, you could even consider going back and being retested for those new genes that we found. So I can't say enough positive things about our genetics counseling program at UTMB. They are excellent. They can put it together to you in words that you will understand. And I think it's a crucial part of what we do these days. And it's just the past year alone, we've had several women who came in with a diagnosis of breast cancer. We did their genetic testing and they had a breast cancer gene.
Yeah. And I have seen studies that have shown, and many times they'll have that gene, but then they don't have that family history. It's just been there. And so then they're able to take dietary changes. They're able to change some of their lifestyles, and we maybe not be able to know for sure that they prevented breast cancer, but at least they gave themselves a fighting chance at that point along the way. And that gives me the other question to ask about is that how much do we know now compared to 20 years ago when it comes to discovering, getting ahead of cancers overall, but particularly in breast cancer?
Well, I can speak for the imaging component. So if you go maybe 20 years ago, so when I was in residency, when I was in training, it was sometimes where patients to get the biopsy were still going to the operating room sometimes, what they call an open biopsy, which means that someone was being put to sleep. It wasn't often, but it was happening more often. Now that's exceedingly rare. So now we're able to do a biopsy that is literally done in the office. We can numb the breast. We don't even have to put you to sleep. We have patients, they drive themselves there, drive themselves home. And we have some that go to work the same day. We recommend you taking it easy that day, but just to give you an idea of what that is like. So the process in diagnosing the breast cancer, as we alluded to last year as well, now we have what we call 3D mammography. So the images are much crisper. We get many more images of the breast, and we can look at it in what we call slices, which means small increments of the breast. So we can catch breast cancers much earlier. So originally, if you go to the beginning of screening mammography in the 1970s, breast cancers were detected. Typically, they were palpable. So typically, someone would feel the area in their breast, and then that's how they knew they had the breast cancer. Unfortunately, that means that it may have already spread to other organs. Now it is not uncommon when Dr. Silva and I and all of our wonderful colleagues meet for what we call tumor board, where we discuss each breast cancer case. It's not uncommon for us to have found a breast cancer that is literally 5 millimeters. 5 millimeters. A millimeter is the size of a piece of hair. So 5 millimeters, tiny. So we're detecting breast cancers much earlier. Some of the cancers, if you look at the staging system, the higher the stage, typically the more the cancer is spread. We are finding breast cancers at stage 0 now, stage 0. So the imaging has really allowed us to find breast cancers much earlier. And the way that we go about detecting the breast cancers is much less invasive than it used to be.
And when you say stage 0, most of the time, I remember a day that anyone was diagnosed with breast cancer, you're hearing he was latter stages almost always. I mean, I'm talking within my lifetime, and now to hear you're catching it so early, you can get in there. And Dr. Silva, for you, that brings up a different approach now. It's like you catching it earlier. You're able to do so many more things now that don't interrupt lifestyle, that don't interrupt someone's looks and the likes. So you can go in and effectively treat.
Yes. Oh, absolutely. When I was in training, being breast surgeon was very easy. Everybody got a mastectomy. Everybody got chemotherapy. That almost is not the story at all today. The vast majority of people are completely fine with a very simple lumpectomy. We're very focused on what we call oncoplastics these days, meaning we expect women who get early breast cancers to live these days. We don't expect them to die. We expect they're going to live. And so 10 years from now, when you look in the mirror, I don't want them to say every day, oh, I had that surgery for my breast cancer. I want it to be forgotten. And so we worked really hard to hide the scars, and we can put them in places that they are not noticeable, underneath the breast, in the armpit. We can hide them lots of places. And a lumpectomy is an outpatient procedure. You go home the same day. You go home taking Tylenol and ibuprofen. I mean, this is not a painful operation, and it's miraculous. Also, everybody got chemotherapy in the day. Now we can hone it down. We can specifically target your tumor and figure out, do you even need chemotherapy? And many women don't. So that's a great advance as well.
And I want to drive that point home, because I think a lot of folks today will think about breast cancer and they think about it in kind of the older terms. And I hate to say older terms, and because this is all within all of our lifetimes here that we are talking about that's changed. But
well, I'm
really,
old, so that's okay. But
no, we weren't going to get into anything like that, Dr. Silva. It goes into the thought of, I just had this conversation with someone the other day who said his wife was holding off a mammogram. She's 39. She's already been thinking about it, but she's going to hold off. She says, I don't have to do it till later. And I said, no, it's easy. Go in, get it done. You know, if you find one of the mobile units, or just call it UTMB Health, you can get it done. And it says, yeah, but if something is found, I said, right. Wouldn't you rather know now? I said, and now hearing what you're saying here, Dr. Robinson, about a lot of times it's stage 0. And what you're saying, Dr. Silva, is the thought that it was that scary thing down the road, like people would compare to a dentist. I'm always going to get drilled, but that's not what's going to happen when you go now necessarily. That when you go in, you can catch early enough, avoid chemotherapy, avoid reconstructive surgery. It is a simpler procedure, like you say, an in and out outpatient procedure now. And that's where things are moving to, and away from you got to get a mastectomy. Because Dr. Silva, I know that in my lifetime, that was it. Preventative vasectomies were not vasectomies. Sorry, mastectomies. Sorry, wrong part of the body. But that having that drastic surgery as a preventative measure was like the suggested route sometimes. Like, hey, because you have this history, go ahead and do that. Have your breast removed, and that was a shock to the system for everyone. And that now that's not the case. And how would you weigh it? Is it 50-50? Is it 80-20? Is it the other way around? Just so people have an actual, because you say the mass majority of the cases have not.
I would say that it's about 80-20. About 80% of the patients I take care of get lumpectomies, and 20% get mastectomies. And those may be people who have a genetic reason why they're going to be at much higher risk than someone else for something to return. Or unfortunately, there's someone who, when they come to us, they have maybe tumors in several different parts of their breast, or just in locations based on the size of the breast and the size of the tumor, that getting a lumpectomy is just not going to be feasible. But again, the vast majority of women, lumpectomy.
Can I add something quickly too, TJ, for what Dr. Silva is being somewhat modest in terms of her surgical ability and the ability of the team. When patients come back a few years later, we mark where the scar is so we can see it on the mammogram. You would be shocked how many times the patient doesn't even know where the scar is. The technologist is also looking and cannot find the scar. That is a very real thing that happens frequently. She's being very modest. Often the patient can't even show you where the scar is from their lumpectomy. That is what we are saying in terms of the cosmetic outcomes are often very good. And so when people have an idea in their mind, well, my aunt went through this, my grandmother went through this, what was done then versus what is done now, it's a whole different ballpark. It is not even in the same realm of what was done before.
And we started talking about some of this 1 year ago in the same topic. And obviously we were coming out of a time in which we were seeing folks not coming in for their exams and everything else, but that the technology has advanced so much, and that, as you said, and modesty may be Dr. Silva's trait here, but I'm glad you brought, because that's where I was headed. Because Dr. Robinson, you're the one going to, when you're going to be one of those that catches folks on the front line here, who are going to like, oh my God, what you found, and said, that's all right. Here's what happens next. And they're not going to see Dr. Silva as the butcher, is the line. I mean, quite frankly, that's what you heard about surgeons when it came to breast cancer before. It was always, oh, they're going to butcher me. That's not the case anymore. That, like you said, 80-20. I want that to resonate with folks. 80-20 on average. We're not going to say, hey, it's always going to be that, but that the chances are of a minor or less invasive procedure to an invasive procedure is the most likely outcome now versus what we saw. And of course, obviously, it depends on when you come in and what you've done in your general health. But it is fascinating. This is why I like doing this show, because these numbers are even better than what we talked about a year ago. If you think about it, I mean, we were not talking on this same level of things. It was getting there, but and then the genetics aspect coming in too is, like you said, Dr. Silva, on the genetic side of things. Speaking of, because we've been having, as I talked about the decline in numbers of people coming in for the regular mammograms or exams and the like. Are you seeing that, Dr. Robinson, in your practice? Are you seeing that trend still downward? Or are we starting to see it come back up again?
No, the trend has definitely, we have turned the tide. So it is now very robust. So there were, necessary precautions that needed to be taken during COVID. We already talked about some people that lost their jobs, lost their insurance. Now people generally are much more comfortable coming in and getting their mammogram. They want to get back to life, and they want to get back to, checking the boxes with all of their preventive medicine. So we are seeing a robust outreach of patients, so much so that we have been hiring new faculty, so new breast imaging faculty. So for those in your listening audience who say, well, I wanted to get into breast imaging, and they told me it was going to be a little bit of a wait. We know, and help is on the way. So we know, we hear you. We know you want to get in. We absolutely want to get you in, and we are very excited that we have new faculty that will be starting in the radiology department. So this is a great time for breast imaging, a great time for patient care.
And I'm quite certain, for those of you watching our show here, if you check your comment section, David Buffet is going to have a link for you if you're interested in going to work in the radiology departments at UTMB Health. There's going to be a link to careers here pretty soon. David's usually pretty quick with his fingers on he works in the background when we do these shows along the way. Let me ask you something, because I talked about, we had to take precautions. I'm glad to hear that we have the uptick going here now. And this is our viewer, Stephanie Gundrum, who came in a little while ago, and she has a question I've actually heard from a lot of folks about COVID vaccines and breast cancer, that the vaccines have led to unusual cancers in general. I wanted to give you all both, as the experts in this field, is there any truth to that, or is there anything anecdotally showing that that's where things are happening based on the vaccines, or any effect at all from the vaccines as far as that?
So I would say, I'm sorry.
Go ahead, Dr. Silva.
First off, just to talk about modesty for a second, which is that Dr. Robinson's team of breast radiologists are excellent, and that's why there's a waiting list to try to get in, because everybody knows the quality is that high. So that's exactly right. But as far as cancer, no, we have not seen that there's a correlation between cancers, unusual cancers, and the COVID vaccine.
Yeah.
I can kind of figure out how a rumor like that could get started. So when you get a flu vaccine or the COVID vaccine or any kind of vaccine like that, temporarily under the armpit on the side where you got the shot, your lymph nodes may get a little swollen for a while. And so we've asked women who've had breast cancer not to get the COVID shot on the side where they got the breast cancer, and then right after that get a mammogram, because it can confuse people. You could see these swollen lymph nodes and you think, oh, is that their cancer's coming back? It's not. It's temporary. It's normal. That's part of your body showing that it's got a good immune system. You're supposed to get that, and it's going to go away in a few weeks. But so I can see where a rumor like that might have gotten started, but there's not any concern at this point that the COVID vaccine is causing cancers. The COVID vaccine is really no difference in the flu vaccine than we've been getting all for years and years and years. It's just targeted towards that virus, but it's made in the same way we've been making the flu shot that we've all been getting for 20 years and we don't think twice about. And
Right.
There's no association between the flu vaccine and cancer. So I don't think that's a problem.
Right. And Stephanie, thanks for asking the question, because I think it's important that when we have those questions come up, let's just knock them down as fast as we can with folks that actually are on the front lines of this. For those of you just joining us, this is a special edition of Health Care Unmasked presented by UTMB Health. We have Dr. Angelica Robinson and Dr. Colleen Silva with us today. And we're also talking about the Bra Dazzle, which is happening the 12th annual, or I should say annual, the 12th, because we had a skip year there to come in. That's happening now this year at the San Luis Resort and happening there. And tickets are still available. We have the website link online, and you can go up and buy your tickets at the door. Starts at 5:30. Tomorrow. I want to see both of y'all there tomorrow. I know, Dr. Silva, you've got like a whole party going on with your group tomorrow. Dr. Robinson, I'm sure you're going to be there with your family.
I will be there wearing my pink. I can't miss it.
Yeah, I see you have your Kendra Scott earrings on right now, right? Am I right? Those are Kendra Scott, right?
They're Kendra Scott-ish. They are.
Yes. Okay. Okay.
They're a little lighter. The Kendra Scott sometimes a little heavy. But I got my pink on. I was gonna tell you too, TJ, an interesting story. The last Bra Dazzle, they had a raffle. You may not know this, but I don't know if you were there or remember that. But I won the raffle and went home with a white rabbit named Snowball. That's still our pet rabbit.
I'd forgot you won the rabbit.
I did.
Where is that rabbit? Is it still y'all's pet for the kids?
She's still our pet. Yes. She's a diva rabbit. So I don't know if they're still raffling off rabbits tomorrow night, if that's a surprise.
And I've seen Snowball, and she's a free range rabbit. She's all over the house.
She's all over. She is she's running things. I thought I could go home as mom of the year. So I bid on the rabbit and won 2 years ago.
I'd forgotten that, actually. I said, because I happened to catch on. I said, wait, are we at the livestock show, or do we go ahead and put things up for that? And it's a fun event, by the way. I should point out, and I'm looking forward to, as we told folks, I was asked here recently to be the MC of the event, so I'm looking forward to being there tomorrow night and having a more formal role with this event. And I'm privy to the surprises from Constable Jimmy Fullen's already told me, and Becky has told me, and I know y'all know some of these. And the surprises it's worth the money alone just to come see the big surprises they're going to have tomorrow night, because those are going to be a lot of fun. There's a lot of corporate backing for this as well. It's in the grand ballroom of the San Luis Resort. That's 5222 Seawall Boulevard in Galveston. You can buy tickets online. We have the link there for you to do so, or you can buy them at the door as well. All the proceeds benefit the UTMB mobile mammography program. And I want to talk about that, Dr. Robinson, if you can. We've talked about how is that used? Where does it go? How is it determined? For example, is there, if someone wanted to have that show up at their business or their building, which has maybe a couple hundred people working at it, is that how it works? How does someone get that to come their way?
So we have coordinators that will work with various locations. We still use the mobile unit primarily for uninsured and underinsured, but we do go to locations for insured patients as well. We just want to make sure that we are, for those that can't get in, that they have the ability to get in. So in terms of the uninsured and the underinsured, we work with various locations throughout Galveston County. So then the mobile unit will go there. And then it's so many places that we go. Sometimes now patients have gone for 2, 3, 4 years. We work with St. Vincent's House. We work with various churches in the area. We do work with, but we work with businesses. We go to health fairs. So it's really just getting the word out. And sometimes patients can't make it to the mobile van, but we have coordinators who they can call. They can call UTMB. We can get them paired with someone who can say, this is where the mobile van is going next. If you need a free mammogram, and even if they don't necessarily qualify for a free mammogram, sometimes patients maybe don't have enough money, but they do have some sort of funding. Sometimes they can work with you on a sliding scale. There's various opportunities that we have. The biggest thing that we have to think about and that we don't want to happen is we give someone a free mammogram, but then they have a cancer. They also need treatment then at that point. So we're also looking on the back end. Do we have grant funding or other other income streams so that we can get these patients the treatment that they need in the event that we were to find a breast cancer? So it's a very much a team approach. We have navigators, coordinators, grant specialists. Everyone is working together to try to make sure that no patient is left behind.
Yeah, and that's the important part of it. It's still the team approach. It's not like the van shows up and then see you later. It is, all right, if someone has a mammogram is found, it's the same approach as if they came into your office. Is that let's get you set. And I would think too, now the added layer to that is having more social workers, navigators, you call them, to find out, all right, how do we get this covered? What grants are available? What government benefits are available, and the like, and that part of the is the part of the process too. Is it not? So they're not left on their own to figure out what to do next.
Absolutely, and Dr. Silva can speak to that as well. We have worked on in these type of situations over the years. We've worked together. Dr. Silva and I have worked together. Now it's been 11 years. So we've been working together over the years. So we definitely, and we both definitely have a heart for all patients. We definitely want to make sure the uninsured, the underserved are getting the care that they need. So we definitely work very hard to make sure that we can find a funding source. Where can they go? Are there other organizations we can reach out to? We really try to make sure that everyone is taken care of.
If there's anything that's come from this today that's important for folks to understand is that, one, there are resources out there for you, whether you have insurance or not. Two, that when you go in for a mammogram, don't let what could happen after stop you anymore. Three, that if you are found to have cancer, a lot of times it's going to be a more simplistic procedure. I say simplistic. You make it simple, Dr. Silva. Lord knows I wouldn't know what I'm doing, obviously, but your expertise comes in there, and that it is going to be an outpatient procedure in many cases, most cases, we should say, and that what you may have heard from the past, don't take the hearsay you may hear at, oh, my grandma went through this. And I'm one of those who could say, listen, I know what my grandmother went through before eventually breast cancer took her life. I know what she went through up to then. But I also know many folks now who have gone through what you described, Dr. Silva, of coming in and having a procedure in the office, and then you're out, come back for your regular checkups, and then they live their lives like normal. I mean, after that, and that there's not that drastic change to their body image. There's not that constant wringing of the hands. And as you said, Dr. Robinson, catching at zero level versus stage 0 versus stage 4 or 3, which we heard a lot over the early days. Any final words? I'll start with you, Dr. Silva. Any final words you have as we wrap up the show today?
I'm going to just add one quick thing to what Dr. Robinson was saying about resources. So we're very fortunate in the state of Texas that we have access to a special type of Medicaid that's just for breast cancer patients. It's part of the Breast and Cervical Cancer Screening Project, the BCCS Medicaid. And so if we perform your mammogram under one of these special programs because you're uninsured or and then we find a cancer, we oftentimes have the resources to just immediately get you into and on the breast cancer Medicaid program. It's not 100% solution, but it is a very good solution, and for many, many, many of our patients. So the thing that breaks our heart is when a patient comes into us and says she's had this lump for a year, 2 years, 3 years, and she didn't have insurance and she didn't know how to get a mammogram. Because then we feel like we were failures. We did not get the word out there that there are resources to give you a mammogram, and there are resources to help you find treatment once you have that diagnosis. So that I want to just re-emphasize. As far as wrapping up, I'm sorry.
Well, no, I myself was not aware of that program. That was a specific for those who may be worried about the monetary deals. That's, again, contacting UTMB Health through all the links we provided for you there is a first step. Don't let anything stop you from making that first step. And I didn't want to interrupt you there. I just want to re-emphasize what you just brought up, Dr. Silva.
Absolutely. And then I was just going to finish up by saying thank you so much for allowing me to be on here today and to try to get the word out to people who maybe don't know about these things, who maybe are scared, who maybe know they have a lump and they haven't wanted to do anything about it. So thank you very much for this opportunity.
Well, as I have learned from doing this show now for 2 years, and when we've talked about this subject every October, that, you know, it is not about let's just kind of talk around the edges of this. Let's get straight in there and tell folks boldly, go get checked out. That's where it starts. They got to go see Dr. Robinson first, and she's fun. She may even, if you request it, have Snowball there for you. I don't know. I don't think Snowball's allowed in for anything. You'll show a photo of Snowball to show you out there. But that's where it starts. And what's great about UTMB Health is this team concept that's gone for women's health, particularly overall, is that when you come in now, ladies, that there is a continuum of care that starts from the first time you walk in the door until whatever it is you're dealing with is taken care of. That's the important part of it here. And you're seeing just 2 members of that team here in front of us today. I've talked to many of them, and we appreciate y'all both. Dr. Robinson, any final words from you today, ma'am?
I would just say that if someone finds themselves in a situation where maybe they did have health insurance, now they don't, that's nothing to be embarrassed about. That is absolutely nothing to be embarrassed about. If someone finds themselves in a situation where, they can't afford the copay, life happens. And as Dr. Silva said, it's heartbreaking when people just don't come in. Sometimes they feel like they've done something wrong. Sometimes they feel embarrassed that their situation has changed, but there shouldn't be any embarrassment with that. And there's no judgment on our end. We just want to see you get the help that you need. We typically can help and find some solution. If we can't find a solution, we try to reach out to other, is there anywhere that we can help find a solution? But the biggest thing I would say is we just don't want there to be any stigma or any shame whatsoever. There should be no stigma. There should be no shame. There will be no judgment from us. We just want to help you.
And that's again a big can help out in that is you can help get folks to what Dr. Robinson just told you, where they can get the care they need despite their insurance capabilities are, and that is with Bra Dazzle happening Thursday night, tomorrow night at the San Luis Resort. Doors open at 5:30. Event goes to 8. There's a fashion show there. There's items you can bid on. You can vote on the best bra, decorated bra that's out there as well. Plenty of corporate sponsors coming in. And again, the tickets are $75. And we appreciate Dr. Silva, Dr. Robinson coming on with us and looking forward to seeing you there. Dr. Silva, I expect you to outbid Dr. Robinson if there's a bunny rabbit. Because I'm afraid if she gets another bunny rabbit, then we're going to go from having 2 at her house to like 8 in no time flat. So it depends on how that goes. But I'm looking forward to seeing y'all both in person tomorrow night. And we will looking forward to see those of you who are watching here as well to come and join us tomorrow night as well. Thank y'all for being on today. We appreciate it.
Thank you.
Thank you.
You've been watching Health Care Unmasked, presented by UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives. providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.